Good afternoon and welcome to the weekly update from the Department of Behavioral Health. I wanted to start off, today is July 1st, so Pride Month is over, but I did want to share some pictures from my recent trip to New York City, where New York City has a lot of pride. You know, in Fresno we had a lot of controversy just over flying the pride flag at City Hall, and it was so nice to see really the embrace of pride in New York City, and lots of examples, including in that lower left corner. You can't see it very well, but there was a pride parade of boats, sailboats, going through the harbor by the Statue of Liberty. So that was pretty fun. All right, on to COVID. 182 million cases of COVID worldwide. We now are over 3 billion doses of vaccine given, and just under 4 million deaths. In the United States, sitting still around 33.6 million cases, over 604,000 deaths, and almost 326 million doses of vaccine. If you look on that right-hand side, we're still seeing cases and deaths down in the United States, but I'll talk a little more about some hot spots. In California, we have 3,712,152 cases, 63,096 deaths. We've done over almost 70 million tests and 41.7 million doses of vaccine. Of note, our positivity rate, which had dipped down below 1, is now 1.4. So we are seeing a small increase, still pretty low, but something we'll want to watch, particularly with the Delta variant, which I'll talk about in a minute. In Fresno, we have just under 103,000. We have 103,091 cases and 1,727 deaths. So far fewer cases are being reported each day and each week. We stay pretty low, but we do continue to have cases and deaths, as evidenced by, as of yesterday, we still had 38 people in the hospital, 8 of those in the ICU, and 24 ICU beds available. We're now at 888,767 doses of vaccine given in Fresno County, representing 387,848 people who are fully vaccinated. That is 84.6% of our population over 65, and I have a new slide to show you, 53.3% of the population over the age of 12. And so as we've opened it up to 12 and older, we are getting more people vaccinated. So in Fresno County, cases continue to show a trend down. Hospitalization has stabilized. Deaths have slowed but continue. We are continuing to slow vaccinations. I believe last week it was about 8,600 vaccinations in a week. Now we're down around 7,177 in the prior week. So we'll continue to make a concerted effort. We know we still have about 70-some-odd thousand people who are waiting for their second dose. There are reports that some people are only getting 1 dose, and we know that that does not provide full protection, particularly with some of the variants. So if you've gotten 1 dose and you've been reticent to get your second dose, please go out and get it. Nationally, remember I reported last week that we were about 20% Delta variant. Delta variant now has quickly become the most prevalent variant in the U.S. Hotspots are emerging, mostly in highly unvaccinated areas. And the population at highest risk are those who are unvaccinated. So this graphic shows you the darker the spot, that's where the hotspots are. The lighter spots have less cases. So in California, you see mostly light, but in some parts of the Midwest and in Texas, there's a lot of COVID going on. Those areas that are white, we don't know. They're not reporting data. And so that's an issue. And so in terms of risk levels, and this analysis was done looking at vaccination rates and case rates in different parts of the country, you can see, again, the darker areas are where the highest risk is of getting COVID right now. And so you want to look at this and really make those decisions based on the risk. So what about the Delta variant? We've been watching this for several weeks now. It's now responsible, as I stated, for most of the U.S. cases, continues to be a great threat to our attempt to eliminate COVID. It is still considered the most transmissible variant identified to date. The only place it's not prevalent is in South America, where the Brazil variant emerged, and that remains the primary variant in South America. We're not, we think it can partially evade antibodies, and remember, antibodies can come from either having COVID or getting the vaccine. May cause more serious illness, particularly in people who are unvaccinated, and may make some of the antibody treatments, the monoclonal antibody treatments that have held out some hope for people who've gotten sick, less effective. And so that is definitely a concern. So what does the science tell us? We're starting to hear, I get a lot of questions now about, well, I'm hearing all kinds of people who are vaccinated are getting sick, or more vaccinated people are dying than than unvaccinated. So I wanted to break some of that down, because there is a lot of misinformation out there, and some of it's just outright flawed. And what I mean by that is it's very interesting, statistics and the law of numbers. I, for a very short period of time, was a math major in college, so I'm pretty decent at math, but this is a common thing that people struggle with. So I'm going to walk you through a few things to help you understand that it's probably best not to rely on reporters to interpret scientific data. And so I'll talk a little bit. First of all, I want to talk about England. There's a conspiracy website that claims that large proportions of people dying in England were vaccinated. And it uses some real figures in a misleading way. So there were 92,029 confirmed cases of COVID due to the Delta variant between February 1 and June 22nd in the UK. 58% of those cases were represented by unvaccinated people, and 8% were fully vaccinated. Another 36% were partially vaccinated. And so you can see unvaccinated represent the biggest, partially vaccinated the next, and vaccinated the least amount of people represented there. And so about half of UK residents were fully vaccinated by the 1st of June. So we would have expected half of the cases to be fully vaccinated individuals, or more if you were more likely to get COVID if you were vaccinated. So, and I'll give you another example that talks about how this changes as more and more of the population gets vaccinated, how it can be kind of confusing. And then there's Australia. Australia has had very little COVID. It's kind of unique. When we first started hearing about COVID, Australia and New Zealand locked down fully and early. They're islands, both of them, and so they have a lot of control over entry and exit to their countries. And they also imposed a lot of restrictions on their residents, which their residents went along with. And they also really did a great job with contact tracing, put some significant controls in place, things like apps on every person's phone where you could track where people were, so that if someone visited a grocery store or a restaurant and later it was determined that someone in there had COVID, that person would get a text saying you've been exposed. And we had that here, but it was earlier in Australia and more mandated in Australia. But even with all of that, they are now seeing the Delta variant, and they're also seeing that the Delta variant appears to be spreading faster, and that the easy transmissibility is undermining even their contact tracing efforts. And here's why. They're really, because it's so few cases, even though they're seeing a little surge, a surge for them is like 200 cases in the whole country. in a small part of the country. And they think a limousine driver who took some, I think it was flight attendants or some international flight attendants to their hotel, became exposed to the Delta variant and was the source of the surge in Australia of 200 cases. And it appears, and they have TV footage where they've got cameras all over. This happens in London too. It's called CCTV. Everywhere you go in London, there's little cameras looking at you. And they were actually able to observe, like, somebody at a cafe got COVID from this particular person, and they were able to observe their interaction, and it was pretty minimal, not the 15 minutes within 6 feet that you would expect to have. So it looks like it's definitely more transmissible. This is why we're going to keep wearing masks. So that's Australia. And now for Israel. Israel has about 80 to 85% of their population vaccinated, one of the most vaccinated places in the world. And it was reported that half of their new adult cases from the Delta variant were in vaccinated individuals. That's true. Half of the new cases are in vaccinated individuals. And so let's break that down, because I really want you to understand. You hear that and you go, what's the point of getting vaccinated? And I'm going to describe to you. And I want to call out Jeffrey Elliott, our epidemiologist in the Department of Behavioral Health and our new quality coordinator, who helped me create this slide to help you understand how math works and why this alarming statistics of half of the people who got COVID being vaccinated makes sense. So if we had 100 adults in a room and all of those adults were exposed to this Delta variant, if 85 were fully vaccinated, and this represents the 85% in Israel who are all fully vaccinated with Pfizer, because everybody in Israel got Pfizer, and 15 of those people were unvaccinated, representing the 15% of the population in Israel who are unvaccinated, you would expect 17 of the vaccinated adults to get COVID. And here's how we came up with 17. The Pfizer vaccine is 80% effective against the Delta variant. There's been some studies that have shown this. So 80% effectiveness means that 20% of the people who've been vaccinated with Pfizer will get COVID from exposure to the Delta variant. So 85 people, 20% get COVID is 17 people. You would expect all 15 of the unvaccinated to get COVID, right? Because they have no protection against COVID. So 17 vaccinated, 15 unvaccinated. There's 32 total cases, which means 53%, or a little more than half, were vaccinated, and 47% were unvaccinated. But the important point here is 80% of the vaccinated didn't get COVID, and all of the unvaccinated would get COVID. So you really have to understand how math works. The higher the vaccination level is in a country, the more you're going to see these kinds of statistics where, yes, a certain percentage of the vaccinated will get COVID. And if you look purely at the number of people, more people who are vaccinated will get COVID. So here's a real simple example too. If 100% of us are vaccinated, everybody who gets COVID would be vaccinated. That doesn't mean that vaccinated people are more likely to get COVID. We know that you can still get COVID, but we also know it's typically not as bad. So hopefully this little example, thank you Jeffrey Elliott, will help you understand that math that makes it both true that 50% of the cases could be represented by vaccinated people, and true that you're less likely to get COVID if you're vaccinated. A little bit of fun science. All right. Some more stuff that science has told us this last week. The CDC, vaccinated individuals who become infected carry less virus. Early on in the pandemic, we talked a lot about viral load and how we didn't really understand why some people seem to infect more people, those super spreaders. And we understood that probably it was because some people, when they get COVID, slough off more COVID. They just have more COVID to share with the rest of the world. And what they're thinking is when you've had the vaccine, you are spreading less COVID. So as you breathe out, there's less virus particles out in the air for you to expose other people to COVID. Another reason to get vaccinated. And we are still seeing less serious illness and deaths in vaccinated individuals. In fact, in some parts of the world, the only people dying are unvaccinated people. So as you know, this is one of those things that in the beginning, it's hard to make hard and fast conclusions from the data. As time passes and more COVID continues to happen, as we have higher and higher numbers of vaccinated people, we'll have a lot better information to be able to share. But the early signs point to less serious illness, less death in unvaccinated people. Another reason to get vaccinated. There's also a little bit of differing opinion about mask guidance. The CDC is standing firm that if you're vaccinated, you need to worry less about wearing a mask, while the World Health Organization is advising that people still wear a mask. Why does this variance happen? And I know it could be really frustrating for the average person to hear, oh, here's one respected health authority telling me one thing and another telling me another. Well, the reason that is because in the United States, we have relatively high vaccination. So the guidance from the CDC is based on our vaccination status and the case rates. The World Health Organization is dealing with terrible outbreaks across the world. And they know in those areas with very little vaccination, even vaccinated people could be contributing to the problem. So they really, really want to put every measure in place. So that's why you get differing guidance, because the population that they're sending their guidance to are different. And that has to be considered when you get frustrated with that. All right. So I'm going to go to some questions. What are staff members to do if someone from the public walks into our building and refuses to wear a mask? Well, not surprisingly, this happens now. So if you're the person who happens to see that person come in, I'd notify my supervisor in security. I certainly wouldn't confront the person or attempt to prevent them from coming in. Just stay calm, have your protective equipment on, a mask at a minimum. If you do interact with the person, you want to respectfully ask them to discuss their service needs outside or near security. And if they can't mask or they're just not in a state to mask, we have put efforts into place. For instance, when we think someone might have symptoms of COVID or can't wear a mask, we see them in the mobile unit outside. And so there's a lot of efforts we've made, and as the return to on-site work plan gets published, we'll put some very specific guidance, particularly if it's not a person served, if it's just a member of the public. And so we'll continue to work on that. Second question, for those staff who have underlying health conditions or live with those who do and are at higher risk for negative impacts or effects of COVID, is there any possibility for a continued hybrid teleworking schedule? This question has come up before, and we'll continue with the same guidance that we would give you. Every case will be taken on a case-by-case basis, looking at the merits or the situation of that particular case. Most of the time, there's going to have to be a form that's completed. That request has to be made formally through the proper channels with those forms. You might have to have some additional documentation or justification to demonstrate why this accommodation needs to be made. And so you should talk to your supervisor in HR, who can make sure that you get those forms, assist you with getting them back to HR, so that that consideration can be made. So if you're in that situation, contact your supervisor in HR, get the forms, and fill them out. I am aware that some staff have received the forms, have not completed them, so you won't get that accommodation if you do not complete the forms, okay? Some questions from YouTube. Is there any information regarding the availability of the vaccine for those under 12 years? Whole lot of work going into this right now. There's definitely some research happening on vaccinations for those under 12, and I'm confident that as soon as they feel it's safe to do so, they will allow vaccinations for individuals under 12. What will we do if the Delta variant takes over Fresno County, especially with kids going back to school? Do we go back to telework and at home? Initial signs would say with the level of our vaccination, even if the Delta variant becomes the predominant variant in the cases in Fresno, it is less likely to result in the conditions we had in the prior surges. And those conditions, remember, all of our surges thus far have largely been pre-vaccination or right as we were starting vaccinations. And those resulted in a high level of sickness and an overwhelming of our healthcare system. Just as a reminder, and it's hard for me to even believe this now, but 38 people in the hospital yesterday, 670 or so just a few months ago. 670. Now that we have vaccinations, and particularly 85% of those 65 and older have been vaccinated, it is far, far less likely, not impossible, but far less likely that even with an increase in cases due to the Delta variant that we'll be in the same situation. Would an increase in cases from the Delta variant result in increased hospitalizations? You betcha. Would it result in increased deaths? You betcha. What would trigger a shutdown of schools, a shutdown of workplaces, a lockdown, with restaurants and that type of thing, would be the impact on the healthcare system and what we're seeing in terms of deaths. And so could it happen? Absolutely, it could happen. And I hate even having to say that. It could happen. It's just less and less likely the more and more vaccinations we get. The longer we go with a core group of people who do not want vaccination, the higher the likelihood that that type of surge would happen, resulting in lockdowns again. And so we'll continue to work really hard to answer questions about vaccines, help people get the facts they need to make the best decision for them and their family about vaccination, and really hope that we can get to the place that we don't have those lockdowns again. When will DBH staff stop screening every morning, or is this going to be permanent? I would say it's semi-permanent at this point. There's a few things that are going to be really, really critical as we move forward. One is that we have this phased approach to return to on-site work. And what that means is we're not going to just bring everybody back in one day. And the reason we're not going to do that is we want to test and measure throughout. So the way that we'll test and measure whether it's safe for us to move to the next phase is we'll screen each day and see if people are reporting sickness. And testing. People still need to get tested both when they're symptomatic as well as surveillance testing for asymptomatic. It's been a few months since I got tested, so it's probably time for Dewan to head out to one of the testing sites and get tested again. Even those of us who are vaccinated, if we get tested, it's kind of like that canary in the coal mine. It's an early warning sign that we might have an increase in COVID in our community. And so I anticipate for the foreseeable future that we'll continue to screen every day, we'll continue to test, just as a metric to measure the effectiveness of what we're doing. Are the measures that we've put in place keeping us safe? And so those are the things that we're just going to have to be pretty disciplined about. So I encourage all of you, along with masking and staying home when you're sick, to also get tested, particularly if you're symptomatic, but feel free to do surveillance testing even if you're not symptomatic. What's the status of bringing us back in phase? Well, we're pretty close now. We are in the final stages of, I think I mentioned it last week, making sure there's consistency in the plan. When we were, the plan is like 140 pages, so we're trying to arrange it in such a way that you can get the pertinent information in a condensed manner, and that the information through the plan is consistent and there's not discrepancies. I know I've certainly heard from some of you when there were a few people who got to see the plan kind of in advance of publication and found some discrepancies, and that's very upsetting, and I understand it, and that's why we're being cautious and careful. And we're not treating this as an emergency to get people back to on-site work. We're just bringing people back. We brought a number of people back already, just in kind of a methodical fashion. And so I anticipate in the next week or two, we'll publish the plan and give you a little bit of lead time, and then we'll initiate that phased approach. Remember, in the beginning, everyone's going to be masked for the foreseeable future, and we'll have some hybrid work models for people who don't have the ability to be alone in a space or not in a shared space. Then we can bring them back, and they don't have to have a hybrid model. But if you're in a cubicle type or a shared office space, you're likely going to have a hybrid model that we bring you back in. Do we know how long the vaccine will last? Right now, they're saying that they're not seeing signs that we need a booster. That doesn't mean we won't need a booster, but remember, because it's a newer vaccine or series of vaccines, it takes time, literally, not because it's work, but because time has to pass for us to see how long the vaccine effectiveness lasts. And remember, this is in combination with these variants coming around. And so researchers right now are looking at the people who were originally vaccinated in the very early vaccine trials to see how frequently are they getting COVID. Is that frequency increasing or staying the same? And how long will that effectiveness last? And is it different for different populations? And so we just have to wait and see. And as soon as they start seeing that in that very early stages of people that they're seeing an increase in COVID than what they would expect, that tells them that the effectiveness is diminishing, and then that booster shot will be needed. Right now, that hasn't happened, but it could happen. And so fortunately, we have a lot of researchers looking at this. They're also developing booster shots just in case we need them. And so I anticipate that by the time they know they'll need a booster, one will be made available. And remember, again, canary in the coal mine, the people who were originally vaccinated got the vaccine way before we did, months before we did. And so we'll know months before we need a booster shot that a booster shot is needed. And that will also give some time both to manufacture that booster shot and distribute it to those of us who were originally vaccinated. All right. Okay, I have a few questions. When was on a booster shot? The Moderna vaccine also just came out this week saying they're effective, relatively effective against the Delta variant, very similar to the Pfizer. So remember, Pfizer was around 95% effective of COVID originally, about 80% effective to the Delta variant, and Moderna looks to be about the same, which isn't surprising because they're both mRNA vaccines. Has any decision been made on how to tell or show if a county employee is vaccinated? Right now, we're going to trust people to report honestly their vaccination status. At this point, everyone's going to wear a mask, so in some ways it doesn't matter. If we were allowing people to go unmasked if they were vaccinated and you lied about your vaccination status, you could potentially put a lot of people at risk with your lie. And so by keeping everyone masked, that's mitigated. I will make sure and tell you, though, that if we do get to the point where you are attesting to your vaccination status and it's found to be in the future that you lied about that, that is grounds for termination. And so don't lie, just wear a mask. Will staff be alerted if someone in the building tests positive for COVID or develops symptoms? We are subject to rules that California put into place several months ago with how we notify staff when someone in their area tests or building tests positive for COVID. I don't remember all the details just this minute, but I will make sure next week and tell you those, or I'll send out an email with the very specific rules that we're subject to. So yes, we are required. There is a very prescribed method and under what circumstances we have to alert people that they may have been either exposed to COVID or in a building where a positive COVID case occurred. So we're still subject to that, and that will continue. I have been told that we are to start having D&D in person at the office next week. I don't know what D&D is, so please text Tina and tell her what D&D is. I didn't hear anything about the rollout of return to work in the update this afternoon. We are always able to bring anyone back to on-site work as needed. And so even though the return to on-site work plan hasn't been published, that doesn't prohibit us from bringing anyone back to the office based on business need. But I'll have to understand better the D&D question and whether or not, what that's all about. I already emailed my supervisor regarding my concern for falling under the higher risk category. I didn't receive a response back. What should I do? Contact HR. If your supervisor isn't responding to you, contact HR. It sounds like you provided the form. I don't think you need another form necessarily unless you've completed the wrong form, or I don't understand what form had to be completed. But you should definitely work with human resources, because ultimately they're the ones that make that decision anyways. D&D is clinical supervision. So I presume this is unlicensed staff being supervised by licensed staff. And so please work with your supervisor if you have concerns. That came from Susan Holt. Okay. We were told by a nursing home we would need to take a COVID test there prior to visiting with our clients in addition to being fully vaccinated. This is probably a state licensing requirement, and as a private business, they can have any rules that they want to try and protect the people that they serve. And so we certainly could look into what's being required by the state at SNFs, but we also would respect that in their desire to keep people safe. Remember, nursing homes have been the highest risk category for COVID illness and death throughout the pandemic. Far more people have died in nursing homes than other settings. So it sounds like they're taking an extra layer of protection, and I support them in doing so. Just my 2 cents. We're happy to look that up for you. Please let Tina know if you want us to look that up and report that out next week. But if it's not under a state mandate or guidance, it likely is their prerogative to require that because they're a high-risk setting. All kinds of people told me about D&D as group supervision. Thank you, team. So helpful. And apparently guidance was sent via email. So please look at your email, and if you're confused about that guidance or you have concerns about that guidance, talk to your supervisor, and they will help you work through that. All right, let's see if there's any more questions. For next week, it would be really great if anyone's willing to, and I promise to keep you anonymous. If you have any theories you've heard that make you concerned about taking the vaccine, or questions that are unanswered in your mind, or things like vaccinated people are dying at a higher rate, and you wanted to share that with us, I would love to be able to provide you with as many facts as I can. So if you have questions like that, or you've heard rumors, or you've heard things that make you really concerned, really whether you've been vaccinated or not, if you could get that information to Tina, that would be great. She doesn't have to tell me who it was. I don't really care who asked the question. I just want to make sure you have the opportunity to have your questions answered. And so if you have questions like that and you want to give me a chance to gather up some resources and maybe even have some experts join me to answer those questions, that would be great. Otherwise, you're just stuck with me and my same old update. So you might have something more exciting if you send in those questions. I do like getting the questions. I appreciate having the opportunity to answer your questions. So keep them coming, whether you're watching this live or you're watching a recording. Send the questions to myself or Tina, and we'll make sure that we cover them next week. Have a great July 4th, and I'll see you next week.